Okay, I'm going to go over the anatomy and physiology of the spinal cord. So starting with the horns in the gray matter, first one is the anterior horn, which houses cell bodies and dendrites of somatic motor. Then we have the lateral horn, which houses ANS cell bodies and dendrites. The posterior horn, which houses interneuron cell bodies and dendrites. And then the posterior root ganglion, which houses sensory cell body and dendrites. Then we have the rootlets coming off the spinal cord, the root, the nerve, and then the root rami all the way over here, which is what spreads off and forms plexuses. So then we're going to talk about the three pathways. These are in the funiculus. And first we have the anterior funiculus, which is in the white matter here. Sorry, I just want to make sure my pen is pointing. So in the anterior funiculus, we have the anterolateral conduction pathway. You have 3 neurons on this pathway. The sensory info carried on it is going to be crude touch, temperature, pain, pressure, and so thinking if like somebody punches you in the arm. The other conduction pathway is the spinocerebellar pathway, which is coming through the lateral funiculus here. And that pathway has 2 neurons, and it's going to be responsible for carrying information related to unconscious proprioception, balance, so thinking of where your body is in space if you're walking on rocks or mounting a horse. Then we have the posterior funiculus, and that is going to be where the posterior funiculus median lemniscal pathway goes through, 3 neurons, and this is going to be like precise touch, so more of a pinprick and conscious proprioception. So those are the pathways that go through the spinal cord. There is also the upper motor neuron of the corticospinal tract terminates at the anterior horn. So that's important to say too. And then the the disease I picked of the spinal cord is bacterial meningitis, and that is actually where bacteria affects the meninges around the spinal cord and brain, which causes the brain to swell, and swelling and pressure on the brain, and this can be a very serious disease, and symptoms include skin rash, headache, fever, feeling confused or sleepy, as well as pain and stiffness in the neck. In severe cases, a doctor will do a spinal tap where they actually put needle all the way into the subarachnoid space, and they pull out CSF fluid, and they test that for the bacteria, and then they treat it with antibiotics. Okay, thank you.